motion that I want you to be able to test is anterior rotation of the ilium, okay? So with this one, we know that, remember, hip extension is associated with anterior rotation, so I'm going to extend the hip, okay? I can extend the hip. Let's say she was having left-sided or right-sided SI, okay? I could just extend the hip and feel the motion because I'm going to palpate the PSIS. Okay, I'm lateral to the sacrum. Yeah, thanks. Can you switch the camera? And I'm showing a little bit different than the picture, so it's actually good that the picture's up. Because in the picture, it shows the other leg is on the ground. Okay, but I could just extend her hip and then do a PA type of pressure to help rotate the innominate anteriorly. Okay, but I actually want to kind of face my hand out, and my force is better directed across the body. Okay, but if it's a big person and you need to be on close to the leg, that's fine. If it's a little person like her, it's easy for me to pass here. And so it's extend the hip, you'll feel the innominate start to move anteriorly, and I'm pushing it a little bit, okay, in an anterolateral direction. Ideally, if the patient can do it, another way to assess that is to have the patient drop their leg off the table. So she's having left-sided SI joint discomfort, and I want to test her anterior iliac rotation. So I'm going to have her scoot over to the edge here, and then I want you to bring that right foot on the ground. Just drop it down. Okay, you comfortable there? So why would this be ideal? Shift yourself. Why would this be a better position if the patient can get to it?
It's causing posterior rotation on that other side.
It's tightening up the system by creating posterior rotation on this side, on the right side. So now when I test the side I want to test, I don't have to, I bring her into a little bit of hip extension, but I don't have to bring her into as much, okay? Because the system is tightened up, okay? So it's recruited the ligamentous system, and then all I have to do, plus I'm in a better line of direction to get an anterolateral force. So I'm PSIS and lateral with this, okay? Because it's iliac rotation. And I'm just doing this. So extend. You should start feeling the PSIS drop a little bit, and then I push along with it as I'm extending and feeling the end feel. Okay. If she is displaced, it will be hard. It will be a block, and it will also be very uncomfortable. So I'm showing two ways. Because some patients are too painful to drop their leg over the edge of the table, or you're just, you know, they're maybe bigger, or you just don't want to do that. So you can do it in prone. So I want you to try it both ways. Okay? Over the edge, and just with one leg close to you. Okay? Oh.